you can see an epithelium like this. Almost every cell is a goblet cell. And you can see these intestinal glands. Extend down to a muscularis mucosa here. Okay? We said that you have the typical features of the wall. You can have submucosa here. Indeed to that, you're going to have an inner circular and outer longitudinal layer, but the outer longitudinal is segmented into tini coli. Okay? And depending upon the section of the colon, you'll either have a serosa or an adventitia. Now let's look briefly at the rectum and anal canal. When we reach the anal canal here, we said there's a transition from simple columnar stratified squamous. And if you look in the muscularis externa, there's a thickening of the smooth muscle that forms the internal anal sphincter. This is smooth muscle. It's not under voluntary control. However, it picks up an external layer here of skeletal muscle, which makes up the external anal sphincter. Because it's skeletal muscle, it is under voluntary control. So you have two separate sphincters, one of which is smooth, involuntary, the other skeletal, voluntary. So when food reaches, when fecal matter reaches the rectum, if it causes the rectum to become distended, then that's going to trigger contraction of that smooth muscle. That's going to trigger the urge to defecate. And with that, this smooth muscle is going to relax. Okay. I think everyone's been in a situation where you're coming home from a restaurant and you feel that urge. That fecal matter is causing distension of the rectum, and all of a sudden you feel the urge to defecate. That smooth muscle that forms the internal sphincter begins to relax. The way you prevent defecation is to contract this external anal sphincter and hold it tight. Okay? You're just hoping that you get home quick enough. You're just hoping that you don't catch any red lights. And as soon as you park in front of your house, of course, you run in. Okay? And you wait till you reach the bathroom, hopefully, before you relax this external sphincter. Now, once you relax the external sphincter, the way you completely evacuate your bowels is to perform a Valsalva maneuver. A Valsalva maneuver is a forced expiratory effort against the closed glottis. In other words, you keep the vocal cords closed so that as you build up pressure, okay, it's not released. Intra-abdominal pressure is going to force whatever contents are present within the colon out through these open sphincters. Okay. Do you need an RN or any other type of license to perform a Valsalva? No. Everybody does it. Okay. But you're simple. What's that?
What was that joke you were saying? The person who like you said always wear gloves.
Oh no, that was a former rectal exam.
Oh, okay.
Yeah, that was.
That's what I think of now.
Right, right. I was talking about doing a rectal exam, and I was asking the students in Pathom Phys, what are some rules for performing a rectal? And this was a long time ago. One said, always wear gloves. And yeah, that's what I'm saying. And someone else said, don't look the patient directly in the eyes. and that would be hard to do because usually the patient is not facing you.
Right.
And someone else says, take all the mirrors out the room. I don't know why that would be, but. So if we look at the rectum underneath the microscope, you're going to see these straight tubular glands coming down to the surface epithelium. And again, if you look at the surface epithelium, it's mostly goblet cells. These glands extend to the muscularis mucosa. Deep to that, you're going to see a submucosa, which has all those things we talked about. It's got blood vessels and lymphatics and nerve fibers. And then you have your muscularis externa, and depending upon the segment, either serosa or an adventitia. The appendix looks just like the rest of the large intestine, with one exception. Within the submucosa, and sometimes extending into the lamina propria, you see clusters of lymph follicles. So in this respect, the appendix can resemble the ileum, okay? With respect to these clusters of lymph follicles. But in the appendix, they're not called Peyer's patches. Okay, Peyer's patches is reserved for the ileum. But the surface epithelium, the surface mucosa is different. Again, in the appendix, you would not see villi. Okay? The epithelium is simple columnar, but most of the cells are Goblin cells. So that's, you know, the look-alike for the appendix would be the ileum now, because of the lymph follicles. Okay. Just wanted to show you this here. When you first open up the abdominal cavity on the dogs, which I think we'll probably do on Monday.
Next Monday?
Yeah, not this coming Monday, but the following Monday.
Right.
So I would ask, again, like we did the first go-round, come just a little bit, you don't have to come as early that we did for the mediastinum. But if you can get here for around 7:30, you know, it takes a little while to open up the abdominal cavity, but it's not near as exhausting as opening up the chest cavity. So what you're going to see is, you're going to see the liver, okay? You might see part of the stomach, but most of what you're going to see is the greater omentum, which forms an apron that's covering most of the small intestine, part of the large intestine. Remember, the greater omentum descends from the greater curvature of the stomach. Okay? It contains fat, it contains lymphatic tissue. This is going to have to be dissected away from its connection with the stomach and the spleen in order to visualize everything else that is present within the abdominal cavity. You'll be able to readily see the mesentery, or in this case the mesocolon, for those organs that are intraperitoneal. And you'll see that the mesentery is carrying blood vessels to and from those organs. Okay? This is just a mid-sagittal view. And this would be mesentery being carried to these loops of bowel. Notice that the rectum actually sits somewhat behind and below the peritoneal cavity. That's why I said the rectum was extraperitoneal, just like the esophagus is. All right. Wow. A lot of stuff. So what we're going to do now is take out the microscopes.